Ebola virus disease. Ebola virus disease, EVD, or Ebola hemorrhagic fever, EHF, is a human disease caused by the Ebola virus. Symptoms typically start 8 to 10 days after contracting the virus, although it may range from 2 to 21 days, with fever, sore throat, muscle pains, and headaches. Typically, nausea, vomiting, and diarrhea follow along with the decreased functioning of the liver and kidneys. At this point, some people begin to have bleeding problems. The virus may be acquired upon contact with blood or body fluids from the infected animal, commonly monkeys or fruit bats. Spread through the air has not been documented in natural environment. Fruit bats are believed to carry the spread of disease without being affected. Once human infection occurs, the disease may spread between people as well. Male survivors may be able to transmit the disease via semen for nearly 2 months. In order to make a diagnosis, typically other diseases with similar symptoms such as malaria, cholera, and other viral hemorrhagic fevers are first excluded. To confirm the diagnosis, blood samples are tested for viral antibodies, viral RNA, and the virus itself. Prevention includes decreasing the spread of disease from infected monkeys and pigs to humans. This may be done by checking such animals for infection and killing and properly disposing of the bodies if the disease is discovered. Properly cooking meat and wearing protective clothing when handling meat may also be helpful, as are wearing protective clothing and washing hands when around a person with the disease. Samples of body fluids and tissues from people with the disease should be handled with special caution. There's no specific treatment for the disease. Efforts to help persons who are infected include giving either oral rehydration therapy, slightly sweet and salty water to drink, or intravenous fluids. The disease has a high mortality rate, often killing between 50 and 90% of those infected with the virus. EVD was first identified in Sudan and the Democratic Republic of Congo. The disease typically occurs in outbreaks in tropical regions of sub-Saharan Africa. From 1976, when the disease was first identified, through 2013, fewer than 1,000 people per year have been infected. The largest outbreak to date was the ongoing 2014 West Africa Ebola outbreak, which is affecting Guinea, Sierra Leone, Liberia, and Nigeria. As of August 2014, more than 1,750 suspected cases have been reported. Efforts are ongoing to develop a vaccine, however, none yet exist.